How can an illegal drug still be prescribed by doctors every day? Marijuana is classified as a Schedule I drug by the 1970s Controlled Substance Act because of its high potential for abuse, no accepted medical value, and its lack of accepted safety. Clayton Holton, a 23-year-old, was born with a rare form of muscular dystrophy. With no treatment for his condition, as he got older, his health grew worse. He was eventually admitted to a nursing home because of his need for constant care. Clayton had no appetite because of all the painkillers. His body weight plummeted to 79 pounds because he was not able to keep any food down. He was first introduced to marijuana by teenage friends, and he realized that after using it, he became very hungry. He continued using marijuana and was able to gain 8 pounds in a short time period of just 2 months. He went from living in a nursing home to living in California, where he now grows his own medical marijuana that's chemical and additive free. His physicians are amazed because generally other patients with the same form of muscular dystrophy do not live past the age of 16. He contributes the success of his health in part to marijuana, helping him eat and helping his body gain strength. As with any drug, there are also negative side effects to marijuana. Because of its illegal status, there are legal risks, including tickets, fines, and incarceration. Smoking anything also causes a risk of lung cancer, and marijuana is no exception. Frequent use of marijuana can also damage one's short-term memory and impair your cognitive abilities. Marijuana can be used to relieve many symptoms. People living with cancer, HIV, chronic pain, and muscular diseases all find benefits using marijuana. HIV-positive people and those with certain cancers that are being treated with chemotherapy all have problem with nausea and keeping food down. Smoking marijuana or ingesting marijuana allows the user to feel hungry and be more able to keep their food down. People with chronic pain also find relief with marijuana, and it reduces their need for highly addictive opiates. People with muscular sclerosis and muscular dystrophy also use marijuana to reduce muscle tremors and muscle spasms. Many wheelchair-bound patients even report being able to walk unaided after using marijuana. There's a wide range of negative side effects associated with the prolonged use of marijuana on a person's health and overall well-being as well. Harmful aspects of marijuana use include health damages to your health, legal risks. Since state laws vary, possession usually includes time in jail. However, in certain states, marijuana programs have allowed users more rights to access their marijuana that's used for medicinal purposes. However, many patients still end up feeling like criminals because the state laws are not very clear in most states. Also, there's a considerable risk of lung damage when smoking marijuana. Many patients who use medicinal marijuana have gone to an alternative called vaporization. Vaporizing the marijuana reduces the amount of carcinogens that are in it, which also reduces the risk of lung cancer. Frequent use of marijuana is associated with short-term memory loss, impaired cognitive ability, and a risk of addiction. Although Clayton is sometimes made to feel like a criminal for relying on marijuana as a means for survival, he will not stop using it. He believes it's been a key component to his health and survival. Many people find relief from constant ailments with the drug, but the risks that are associated with marijuana use must not be forgotten. Each day, more and more is learned about the risks of marijuana and the positive aspects of marijuana use for people with chronic diseases. Medicinal marijuana is a huge debate in the United States right now, and being informed on the subject will ensure that we as citizens are not blinded by smoke and mirrors.